before we start, let me tell you a little bit our parents roundtable discussions. So for those of you who are new, this is our third season. So this is our third year since we started this. The main thing was to educate parents on child health and developmental issues. And since we started, we've gone through so many topics. And I'm sure those who've been here from the very first time will say that they've learned quite a lot. Today, for the very first time, we want to concentrate on parents' health. It's a really important thing, and I'm even ashamed we haven't done this before. We are all into child health, but you know, as parents, if you yourself are not healthy physically, emotionally, spiritually, if you are not healthy as a whole, as WHO puts it, then you will not be there and have the strength and wherewithal to be able to look after your children. So it's really important that we learn how to keep ourselves healthy. As parents, sometimes we are just going. We forget about ourselves. And then, I mean, things happen, but you need to think about it. If you are not healthy and God forbid, you leave your children on this earth, who's going to look after them? So we need to be healthy as children. I mean, as parents. So to do this for us, let me give you a short, brief introduction about our speaker for this evening. Our speaker is Dr. Ayungo Annan. She's a specialist family physician, a member of the West African College of Physicians, and also a member of the Ghana Medical Association. She's also a member of the West African College of Physicians and a member of the Society of Family Physicians of Ghana. She works at the Kolebu Teaching Hospital Department, the Family Medicine Department, and she's in charge of the Polyclinic Women's Clinic. She's also second in command of the Training and Research Unit at the Kolebu Polyclinic. She is a speaker on various platforms, and for me, she's also a lay preacher at my church, a very powerful woman of God. She loves to sightsee with her family, and she likes to educate people about health, like she's going to do for us today. So let us welcome Dr. Ayungo Annan with our virtual applauses whilst she educates us this evening about preventive health, how to keep healthy. Ayungo, you are very welcome to our Parents Roundtable discussion. Today, your audience are parents, and we'll have some health professionals also joining us. So you have a mixture. The floor is yours. You're muted.
Sorry.
We can hear you now. All right.
Thank you very much for this opportunity. I'm very grateful to be on Parents Roundtable, and it's a great honor. It's a privilege, and every opportunity to speak to people I think is a very, very great one. So thank you very much for having me. I think I have listened in a number of times over the years that you've started. And last year I had the opportunity in December to join when you had the fair at the Ridge Church School. But there I joined in as a businesswoman. So it was a very interesting time, and I had fun over there. So today we are here to talk about preventive health for parents. I just wanted you to know or have an idea, since this is virtual, we need to be very interactive, at least see who is talking to you. And then I'm going to put my video off, and then you're going to focus on the slides till such a time when I'll turn it back on again. So we are going to be talking about preventive health for parents. Marilyn has already mentioned, I work at the Kolibu Polyclinic, and I'm a family physician there, and one of the 2 doctors in charge of the women's clinic we run at the Polyclinic. So this will be my outline. You know, virtual can be very, challenging. You don't know what's going on the other side, but we will manage. We will do well to interact very much, and then we'll carry on. So this will be my outline, a brief introduction. We'll talk about what preventive health is, levels of prevention, the importance of preventive health, how to achieve it. Some preventive health screenings we'll go through, and then we'll have lifestyle modification, and then we'll conclude. Then you have time also to ask questions. So Happy New Year to you all once again. And I just want to start by saying I like Marilyn's, Dr. Mabel's intro when she said we need to be whole in our minds, in our emotions, in our bodies, in order to be able to take care of these wonderful gifts in the way of children that the Lord has blessed us with. So the fact that we are body, we are soul, and we are spirit. And remember that we also didn't come into this world just to walk up and down, but we came to fulfill destiny. And we need to fulfill purpose with the wholeness that we need. So, preventive. I just tried to find out the meaning of these words. And this is what I gathered. The action of stopping something from happening or arising. And designed to keep something undesirable, such as illness or harm, from occurring. This is prevention. Now, I also tried to find the definition of health. And WHO tells us that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We can get from 1 Thessalonians 5:23 that now may the God of peace himself sanctify you completely, and may your whole spirit, soul, and body be preserved blameless at the coming of our Lord Jesus Christ. So these 2 helps us to know that we are not just body, but we have a soul, we have a spirit, we have a mind, we have emotions, and all these must be whole. All these must be undergo some form of prevention for us to be able to make it. So this is the body, that's the physical, and so we talk about the mental, emotions, and then your social being. Then your spirit, we talk about spirituality. What is preventive health? Preventive health aims to prevent illness and assist in the early detection of specific diseases, whilst encouraging the promotion and maintenance of good health. So you try to pick the conditions early, and then also you promote good health as well. Now, this can be achieved by routine health screenings, checkups, to help prevent diseases and to counsel clients about disease and health problems that they may have. So this is like a triangle kind of thing with a WHO definition: physical, mental, and social well-being. I also tried to look up other people's components of health, and we can see that clearly. This is just to reiterate the point that it's not just the physical. We have about 5 things here: physical, emotional, intellectual, social, and spiritual. These are 7, and these are 8 components of health. So health is a whole thing. And sometimes we joke about some of these things, but if you look at the second box, it talks about financial. And I was sharing with somebody, and I was like, well, I mean, if your finances too are not good, there was a statement you used to make that, you have pocketitis. So it's also a kind of ill health that can really, really cause a lot of instability in a person. So it's a serious matter that we need to look at. So what are the levels of prevention? We have primordial, primary, secondary, tertiary, and quaternary. I'll just make this very simple because I know some people are not in the health industry, but it will be very simple for you to understand and take something home that because of these things, that is why we need to introduce prevention very early. So primordial prevention is just preventing the risk factor. So this is usually done at national level. For instance, a nation can decide that no smoking in our country, or we put some kind of components in our water to prevent dental caries. So that is above you, the individual. Primordial, it's like a national affair. Now, primary prevention, that is about treating the risk factors to prevent cardiovascular disease. So cardiovascular are just like heart diseases or any other disease for that matter. So you treat the risk factors. So for instance, there you yourself can decide you are quitting smoking or you've been exposed to it for a while and you want to quit. So that is like you are treating yourself from all the risk factors. Secondary prevention is when you are interested in detecting the disease early before the symptoms even present, thereby minimizing the serious consequences. So this involves screening programs. Basically, this kind of thing involves screening programs. Yes. Then we go on to tertiary prevention. Okay, which involves when the disease has already occurred, and then you want to prevent complications. So here, things were not done right, the disease occurs, and then you want to prevent complications, thereby reducing what we call morbidity. Morbidity is the inconveniences or the complications that a client who has had a disease has to live with. So that can make it uncomfortable for them. So tertiary prevents those complications. Quaternary has more to do with a term we call over-medicalization, where somebody comes in who doesn't even have any risk, and we do all kinds of invasive investigations to actively looking for something that the person is not even at risk or not showing any symptoms for. That is what we refer to as quaternary prevention. This is just to give you an overview of the levels of prevention that we have. Now, what is the importance of preventive health? It may help to prevent illnesses, may help to prevent diseases. Now, you will ask me that, what's the difference between an illness and a disease? So a disease has to do with the anatomy, the pathology, or the problem with the organs. An illness process is like how you perceive what is happening to you. So because of this particular disease and illness difference, in family medicine, we have something we assess your illness experience. So we are not just concerned about that pain in your head, no, or that thing happening in your body, that chest or that abdominal pain, no. We are concerned about how you are perceiving it. So we ask you about 4 questions. What is your idea? What is going on? What do you think is going on? And we also ask you that, do you have any fears or feelings about it? Because somebody may be sitting there, it's just the fear of something she's thinking about that is just going to even push them further into their pits or whatever it is they are going through. Then we also ask you whether it's affecting your functioning and your expectations of care. So we try to find your illness. So illness and disease are 2 different things. So this preventive health will help you to prevent illness and to prevent disease. May also help you to prevent other health problems. And then it also helps in early detection of disease when there's teamwork, and then treatment works best when it is picked up very early. Now, how do we achieve preventive health? I put in these 2. It were multiple questions. You have to say that maybe whether one is your answer or 2 be your answer. So we say that having various checks on the body and living a healthy lifestyle, or living a healthy lifestyle and having various checks on the body done. Living a healthy lifestyle and having, so I don't know if I can be a bit interactive. I don't know whether we can call any names, but can anybody volunteer any answer? Which one would you pick? Will you go for 1 or will you go for 2? Which one will you pick? You can put, somebody has raised their hand. Okay. Nyamidoba. Nyamidoba, is your hand up? Hello. Okay, she has answered. Oh, she will pick 2. That's a good one. All right, let's carry on. Thank you very much. So, some preventive health screenings for general, when we say general, we are talking about men and women alike. So your blood pressure, your blood sugar, your body mass index or BMI, your liver function test, lipid profile, urine routine examination, renal function test, and ECG, which looks at your heart. And then for some people beyond 50 years and those with a family history around 45 years, we would also like to test for colon malignancies as well by either doing a stool for Ocal's blood test or one or the other. Now I tried to find out the approximate costs of these medicals minus the stool test that I put there. And the low end is about 483 Ghana cedis for all those tests. And the high end is about 745 Ghana when you want to do a private lab, like probably Lancet or any of the big labs. Now, for the women, we may also have breast cancer screening, cervical cancer screening, well woman visit, and then the well woman clinic. You know, the well woman visit and the clinic are 2 different things. The visit, when a woman comes for a well woman visit, the things you do there are to examine or take history surrounding the reproductive organs of the woman. Now, a well woman clinic is a clinic for women which has other things within the clinic, such as a pre-conception care, counseling, STI treatments, cervical cancer screening is there, breast cancer screening. You may have other things within that clinic which a woman can assess care for. For the men, they may also have their colon tests for colon cancer done, and then their PSA or prostate-specific antigen also may be done for them. Now, we start with the blood pressure. Okay, I think I see some questions, but let's do the questions at the end.
Yeah, I told them to put it in the chat, so we'll do it at the end.
At the end, all right.
Yes,
so
please.
let me just go through the presentation and we'll take the questions at the end. So the blood pressure, position and conduct, you should be sitting. The machine or sphygmomanometer should be at the level of your heart. And then what is normal? Your normal should be less than 120/80 millimeters of mercury. Have you had your blood pressure done this year? Hypertension is a condition of high blood pressure which runs within families. And then we know with the blood pressure, we have a bracket where between about 120 to 139 and then 80 to 89, where we call pre-hypertension, where a lot of lifestyle changes can be done before you go into frank hypertension, which is above the 140/90 reading. And take note of this. You know, when sometimes somebody comes and asks, what was your blood pressure reading? When they mention one figure, oh, it was 150. No, it's always 2 figures, one on top and one beneath. So you can observe both, write it down, keep it so that you have an idea about what your levels are. Now, hypertension runs in families. Just a quick overview of that. Runs within families and sometimes can be stress related. All those other risk factors are available, high salt intake in your diet and all that. Sometimes the signs, there may not be any signs or symptoms at all. Sometimes you may have headaches, you may have dizziness, some people may collapse, some may even come with a complication. That is the first time they come in. Last Friday or Thursday, I had a call that somebody had been admitted to the ward and somebody was finding out whether she could come and visit. And this person was fine, walking about, doing his normal work. He's an accountant, he's working hard, doing his regular work. And all he's experiencing is headache, pain in the back of his head towards his neck. That had been going on for about 3-4 days. So he decides, let me check my blood pressure. It's about 230 something over 116 something. He actually drove in So I told him, wow, this is a total miracle. God really, he loves him because, those kind of pressures. So somebody may not have it like that, but this is how someone's presentation was. Nothing but just a slight headache at the back of the head towards the neck. So this is why it's important for us to know your blood pressure. Now, how often should you check your blood pressure? When you look inside literature, they talk about 2 to 5 years for those below 40 years. But you see, they are using their statistics that they have gained. Where we are, we will advocate for at least yearly. That should be your list. As for above 40, it is mandatory to do the yearly. But below 40, at least once a year, you should know what your blood pressure looks like. And for those who are already hypertensive and are on medication and go for clinics, go to the clinic regularly, you have to make sure you attend or keep your appointments very well, thereby making sure the blood pressure is well controlled. We are moving on. Blood sugar. Your normal levels for your sugar should be between 3.9 to about 5.6. Anywhere from 5.6 to about 6.9, you are in the pre-diabetes range. Above 7, on 2 separate readings, you are a diabetic or you are diagnosed as such and you are treated. We use various, we can use the fasting blood sugar, we can use the random blood sugar where you haven't eaten. Fasting is when you haven't eaten. Random is when you've eaten. Usually we even try to take the 2 hours postprandial readings. When we say 2 hour postprandial, 2 hours after you've had your meal, there should be a level. Your levels of your sugar should not be beyond 8 millimoles per liter. So those that can be used for diagnosis, your glycated hemoglobin, which is what we call HbA1c, should not be more than 7. So these are some of the measurements that we measure, and then we make sure that you are either you are not or you are, and then the necessary treatment. Then again, diabetes too, sometimes in the beginning, you may not see any symptoms. Some people may realize they are urinating frequently or in large quantities, drinking a lot of water, eating a lot, but they are losing weight. Some may be having frequent infections. For females, maybe vaginal infections or frequent urinary tract infections. And then you should be able to begin to think what is going on and then get checked. But all these things, we are not waiting for, we don't want you to wait till these things occur or you see these signs or symptoms. That's why we are calling it preventive health. Get your blood sugar and your blood pressure checked so that you know what your values are now. And then you will be able to live a more healthy and a more productive lifestyle. I just chipped this in to break the monotony a little bit. So these are what we should be having: fruits and vegetables. We can see them there. We should be having a lot of water, at least 3 liters of water every day, 6 sachets of water. And we should pick our gadgets. Skipping rope over here, wear your running shoes, go running, go walking. It's about time we changed our lifestyle. And all these things, as Habakkuk puts it, write the vision, make it plain, get a notebook, write what you want to do. Your BP, your sugar, you want to change your lifestyle, put something down. You read it, and then it will inspire you to carry on. We are moving on. So the body mass index is also something that we should look at. The BMI, body mass index. It's a figure that is derived from dividing your weight in kilograms over your height in meters squared. So your weight in kilograms over your height in meters squared. So if you are 60 kilograms and you are 1.6 meters, so it's 60 divided by 1.6 squared. You square it before you do the division. Or if you are using a calculator, then you divide it by 8 twice. 60 divided by 1.6 divided by 1.6. That figure you get, the normal is between 18.5 to 24.9. So you should get yours too done this year. You can even check any nearby clinic will show you. You may already know your height, your weight. You have a scale at home. Your normal should be between 18.5 and 24.9. When you are overweight, it's between 25 and 29.9. Obesity is greater than 30. When that division is done and you have greater than 30, we have 3 levels. Level 1, level 2, and then morbidly obese. So level 1 is between 30 to 34.9. 35 to 39.9, level 2, and greater than 40, we say you're morbidly obese. When we say morbidly obese, it means that that kind of obesity that is associated with disease or brings on disease. So the body mass index is another assignment that you should get to know. It's not to get to know to discourage you, no, but to get to know to do something about it. Some of us also who talk about it, it's good we talk, because after we talk and we sit down, we sit back and we are sitting down doing something else, it's like our mouth, our words reverberate to us. And we are also able to, I remember last week I was educating somebody about eating vegetables, and I had, so when was the last time you ate vegetables? The following day I was at the market, I bought some to fulfill all righteousness, cut it up, and I mean, to show that, oh, at least I also have a moral right to say it to somebody. So, I mean, these things are just for us to remind ourselves all the time. We are all not perfect. We are all on a journey, as a friend put it today, to our mountaintop. So along the journey, all these things come in for us to make ourselves better so that we can reach that high place, that high calling, that high destiny, that high purpose that the Lord has put in store for us. Waist circumference. So the waist circumference, the normal for men should be around 94 centimeters to about 102. 94 centimeters is like, I mean, optimal, normal. For the women, we say 80, thereabouts. Because remember that the fat around your waist is supposed to be a marker of the fat around your heart. So that is why the waist circumference is also now a way we are going to. It's very important. And you know, we don't measure it like the way we measure it at the tailor's place or at the dressmakers or seamstress or your designer's place, where you breathe in, you tuck in your stomach to put everything in shape. Then she measures it, oh, 28, you breathe out, is something else. No. This one, when you are measuring it, you're actually taking a deep breath and you let all the air out and you measure it in expiration after you have breathed out, and you check that figure so that it will give you the real deal of what your waist circumference is. Now, we also talk about the waist to hip ratio for women, optimally around 0.8, men about 0.95 to about 1 thereabouts for men. Sure, some people are breathing in seriously. The women, the females, we have some special things about them that we need to look at by way of screening and by way of preventive health. The breasts. So we need to look at the female's breasts. Usually, sometimes there may not be any sign of breast disease. Sometimes you may see a nipple discharge. Sometimes a lump may be felt. There may be some pain somewhere, a wrinkling, a dimpling, something like looking like an orange peel, some kind of change, one breast being larger than the other. You may see some kind of sign. Sometimes you may not. There are some investigations when you come in, we take a history, but we don't want you to get to that. So we say that every woman should screen their breast. Now, internationally, they are moving away from the self-breast examination. But I mean, speaking to our surgeons here in Ghana, we can't move away from self-breast examination. It's very helpful. And also the clinical breast examination, very helpful. That we say you should do once a year. Self-breast examination for the women, we say you should do it at least once a month, about 5 to 7 days after your menstrual period. You do it. And then the clinical breast examination once a year. If you want, you can wait till October when there's a free screening, and then you can come in and get screened. If October passes, you haven't done it, you can still come in and ask your doctor or a trained nurse, you want your breast examined, it will be done for you. We call that one the clinical breast examination. Now, you can see here, you look in a mirror, you lift up your hands, you check, you are looking, visual inspection, you look at it, you are looking, what are you looking for? You're looking for signs, you are looking for any lesions, any swellings, any skin changes, any kind of darkening, any nipple. Sometimes the nipple goes in, we call it nipple retraction. You look at all those things. Then you place your hands also on your waist. It also helps to firm things up for you to see things a bit more differently as well. Then you use gently the parts of your fingertips. You press it against the chest wall. The idea is that when you press your finger against the chest wall, it hits bone. So when there's a lesion underneath, you'll be able to pick it up. And I always say you can divide your breast into about 7 areas. Okay, so these are the things you are looking for during a self-breast exam, whether there's pain or tenderness, there's a discharge, some itching or scaling of the skin, dimpling or puckering of the skin. If you feel a lump, you can report after that. Now look at the division. You can see the upper outer quadrant, upper inner. So you make sure you touch all these areas deeply to touch the chest bone. So you see 1, 2, 3, 4. You don't forget the areola area, that is 5, around the nipple area. And then the axillary breast, we call this place axillary tail. Some people have a bit of the breast extending there. And then you also examine under the axilla, making a total of 7 areas. You make sure at least you've touched all these areas. And then you would have done yourself a good service and you would have done a self-breast examination. This is a picture of a clinical breast examination being done by a doctor. We have some nurses who are also trained. We have a breast unit here in Kolebu. Fantastic nurses who are trained, and they are all able to perform this maneuvers as well. Now, when we find anything in your breast, I just wanted to demystify some of these things or just put them across. We may ask you to do an ultrasound if you are below 40. You do an ultrasound scan. This is basically how that is done. Or a mammogram if you're above 40. This is how a mammogram is done. The images are sent for reading, and then whatever results are communicated to you. We are moving on to cervical cancer. That's another area that women should be looking at critically. So that one too is cancer of the cervix. You know, the cervix is the mouth of the womb, where it expands to about 10 centimeters before the baby or the head of the baby comes out at delivery. There may be no signs or symptoms, or you may have bleeding in between your menstrual period, or you may have pain during intercourse or post after intercourse, or bleeding after intercourse or sex, all those things. But we don't really want you to get to that level. So we are looking at you doing your regular screening all the time. At least when you do it for a year and it's fine, the next time will be about 3 or 5 years that you get another one done. So we are looking more of screening. Get screened. This month in particular, January, is Cervical Cancer Awareness Month. So every woman must have a pap smear done, a VIA, visual inspection with acetic acid, some form of screening done. I mean, sometimes spouses can even give some of these screening tests as a package, as a gift. Oh, get your medicals done. Oh, get on your birthday, get your paps done. Or we are more interested in maybe the perfume or something. But the cervical cancer screening too is very, very important for us to get done as well. Now, these are the various tests we have. We have the visual inspection with the acetic acid, and then the pap smear, and then what we call the HPV or human papilloma virus test. Human papilloma virus is actually the causative organism that is implicated in cervical cancer. So we test for that as well. When you do a pap test together with a human papilloma virus test, we call it co-testing. We call it co-testing, and that when everything is normal, you can do it every 5 years when all things are normal. The VIA you can do every 3 years. That one is visual inspection. So we stain the cervix with vinegar, ordinary vinegar that we can put on salad leaves. And then we look at it and see whether there's a change in color. Then we'll be able to tell you exactly what we think. Now, there's an issue of vaccination also now available for us as well. So we have Cervarix. The idea of the 16-18 are just targeting those human papillomavirus types that are very notorious to cause warts or cervical cancer are implicated in them. So these, for instance, 16 and 18, very notorious for cervical cancer, 6 and 11 warts. So this is like a quadrivalent vaccine, Gardasil, and this is a nonavalent. About 9 of the HPV viruses are captured here, or you vaccinate against these 9. And the vaccination, we should be looking at our teenage children from 9 to about 14 years. And for them, we give them 2 shots at 0. The vaccination for the cervical cancer is just like hepatitis B, at 0, at 1 month, and then at 6 months. So here for the children, if you are less than 15, we do 0, the first shot. Next shot is at 6 months. But if you are above 15, then we give you the 0, the 1 month, and then the 6 months dosages of the vaccine. I try to find out the cost also for us to be educated about it. So for the quadrivalent one, is about 750 Ghana cedis for a shot, for 1 shot. So when you take the shot, or your child takes the shot, then you should be preparing in 6 months to take another one, or in another 1 month, and then you should be able to know that you have the full stretch, or you'll be able to afford the full stretch so that there's no break within the vaccination. And then the nonavalent one is 2,500 per shot of the vaccine. Just to demystify cervical cancer a little bit, or the screening a little bit, because most people are afraid. This is a disposable speculum. It's plastic. This is the slide. This is what we use for the conventional, we call it a conventional pap kit. So for this one, we use a slide, and then we stain it with, we use alcohol to fix it, and then we go and look at it. The pathologist looks at it under the microscope and then gives us a report. So this is the conventional pap test. This is the positioning for the cervical cancer screening. Lithotomy position with your legs up, and then we take the sample. These ones, you can see they are holding a cotton swab. It's likely they are doing a visual inspection with acetic acid, where we dip this cotton into vinegar and then dab the cervix, wait for a minute, and then we observe the change in color or otherwise of the cervix. This is also liquid-based cytology. It's also a pap smear kit, but this one, unlike the other one where we take sample from 3 areas, for this one, we just go in with this one cyto brush, and then you can see how it is shaped. Some of the nozzle goes in, others are outside, and we sweep around the cervix, and others will pick from the endo or the inside of the cervix. You put it into this preparation, and then you have your liquid-based cytology. With this one, you can be able to do the human papillomavirus test as well, and then you do the pap smear. So for the combination, it's about 320 Ghana cedis to do that. The conventional pap is about 150. Liquid-based can be about 170 to 180. And these are quotations from Kolebu. I don't know the other quotations from other facilities. Now, some of the don'ts, we tell you before a pap, you shouldn't have intercourse before a pap, about 2 days, avoid intercourse. Avoid douching, placing things within the vaginal area, vaginal medicines, spermicidal and foams or jellies. They will help, they can mar or destroy or mask the cells within the cervix. So we usually tell you these, and you shouldn't be in your menstrual period as well. Those are the things for the pap. Well, the pap test is not painful, but it's not comfortable. That's one thing we tell them. And don't be shy. Sometimes people are afraid of the unknown. We are all within the same brackets, but we need to know some of these things, because cervical cancer, for instance, takes a very long time to develop, within which time you have so many years to have screened for some pre-malignant or pre-cancer lesion to be picked up and then treated or handled before it gets out of hand. This is also another slide just interrupting us to tell us about a healthy lifestyle. Do your regular checks, immune system, eat a balanced, healthy diet, exercise, avoid smoking, sleep well, maintain a healthy weight. We've spoken about a lot of those up there, just to let you know some of these things. Men's clinic. So I don't know whether there are slated men's clinics, but I know the genitourinary department of Kolebu, for instance, you can have a men's consultation. I don't know whether there's a clinic named like men's clinic, but I know these are some of the issues that are discussed there, issues of low testosterone, enlarged prostate cancer, erectile dysfunction, premature ejaculation, all those issues. They can worry the mental health of a man. So we will need to address some of these issues when a man comes in within the clinic with these concerns as well. So for the men, basically their prostate-specific antigen levels, when it's above the 4 nanograms, we will need to do a rectal examination to check the size, the consistency. We check the surface, whether the prostate is hardened, whatever we feel over there. If we are not sure it's enlarged, all those, we do a scan, ultrasound in addition, and then we refer them where they can get a biopsy or they can take a sample of the prostate gland for check, and then whatever situation occurs is handled. So now we are zooming into lifestyle modification. We are rounding up shortly, don't worry. I hope you are all there. Nobody is. I remember when Zoom started initially, there was a picture on WhatsApp once that made us laugh so much. Somebody was asleep in her bed and the Zoom was running and she had put a dummy there with a wig on. So I hope we are all awake.
We are all here.
Thank you very much. Bless you. So lifestyle modification. We are moving from this end to this end. It's a very thin rope. The guy it's not easy. It's not easy for him, but it is possible. And there's always a starting point. So this one suggests also same lifestyle health thing. Let's skip it. So these figures, I want us to have these figures in mind as we go through 0, 5, 10, 30, 150. Rule of lifestyle modification. Oh, some quick guess. Who can guess what the 10 is? Just so that we see that we are awake. Anyone to guess the 10? Or they've all been muted, or writing it in the chat box. Okay,
yeah,
they've
they
been
should
muted.
write it in the chat. Yeah.
Write it in the chat box. So who can guess what the 10 is? Okay, so let's go to the next slide. Okay, so 0. We say if you smoke, you should stop smoking. If you smoke, we say stop smoking. That is for the lifestyle modifications. Stop smoking, because smoking is one of the causes of many of the cancers, hypertension, diabetes, lifestyle diseases. So internationally, we say stop. Now 5, we say take at least 5 helpings of fruits. I should have added, sorry, fruits and vegetables daily. At least 5 helpings. And please, when we are talking about the helpings, all the fruits have their helpings. So sometimes a client comes to you and say, oh, doc, Charlie, doc, the way I like fruits, every break time, I eat 5 Ghana worth of bananas with 2 Ghana groundnuts. No, the fruits have helpings. So with orange, the helping is 1 orange a day. Apple 1. Bananas, if it's the short ones, the local ones, it's 2 a day. The long odocho, the foreign ones, is 1. If you are going to eat the cut up fruits like watermelon, pawpaw, any of those, then a saucer full will be a helping. So when you're talking about, it's not just about eat your fruits and vegetables and you buy a big watermelon. Today, me and the watermelon, we are going to tango over here. You have the whole melon to yourself. No, that is not what we are talking about. You need to also have that in rations, because remember that some of the fruits have sugar in them. Others also have cholesterol and have other things that are not too good for you also within them. Now, you should have at least 10 minutes of relaxation daily. I was watching a video clip recently on WhatsApp talking about napping. Now, napping is a very powerful thing we need to do. And napping reduces cardiovascular disease. And I realized, oh, it's in connection with this thing. You know, that kind of nap where you sleep for 10 minutes as if, oh my goodness, you can take on the world. You come back refreshed, revitalized. You need to make time to rest 10 minutes at least every day. Your body mass index should not be more than 30. And then you should have at least 150 minutes of moderate exercise 5 days a week. 150, of which we say 30 minutes a day. When we talk about moderate exercise, walking fast, doing water aerobics, riding a bike, playing doubles tennis, pushing a lawnmower. These are a few examples I picked up. Skipping is also part. Swimming, they are all part of those moderate. In fact, swimming is a bit more vigorous even. So these are moderate exercises that you can engage in. This is some people going on exercising. So at this time, I would like us to pause briefly. Wherever you find yourself, please, you don't need to show your video. If you want to show your video, you can show it, but please, you'll be sitting for a long time, for more than 30 minutes, more than even 45 minutes. So please stand up wherever you are, stand up. We are going to do a very brief one. I was thinking of for you to use your waist to write your first name, but some people will struggle because I know a friend who told me his name is Nyango Mango. So how is he going to spell all this thing with his waist? By the time he finishes, maybe you have waistitis of some sort. So please, I'll not put you through that. Just a simple Sunday school one. We are going to do my head, my shoulders, my knees. We will not let the virtual intimidate us at all because you've been sitting for a while. Please stand up wherever you are. Stand up in your office, wherever you find yourself, stand up. So the short, very brief one. So my head, my shoulders, my knees, my toes, my head, my shoulders, my knees, my toes, my head, my shoulders, my knees, my toes, they all belong to Jesus. Then we'll do a very fast one. This one very fast. Head, shoulders, knees, and toes. 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 Please, don't, some are not locating their head, their shoulders, and their knees. Okay, just a pause. Let's go on. Let's carry on. We are boxing on. We are finishing very soon. So remember slide 5, when I talked about the fact that we are body, we are soul, and we are spirit. And WHO definitions have told us all that. So we also look at these areas of our lives as well. We know that there's spirituality in life, even within our family practice. We assess spirituality. So we do a hope assessment. We can do a FICA assessment. An example of the hope assessment is this. You can even do it on yourself. As I ask the questions, you can also jot down what your answers to these questions are. This is how we assess spirituality. We believe in it, and we use it even in addressing the patient's healthcare because it's important. Otherwise, they will find other sources of healthcare. So we say, what are your sources of hope? You as an individual, what are your sources of, what gives you hope in life? What gives you hope? Do you belong to an organized religion? Christian, Muslim, whatever. Do you belong to an organized religion? Do you have personal beliefs aside that of the organized religion? And then how do you expect us to apply your beliefs to your care? This is an example of a spiritual assessment we do on our clients where I work. So depending on what you say, for instance, in end of life or any other kind of care chronic, okay, I would want to take communion. I want my pastor to come and preach. So we make room for all those things because it's been shown that spirituality is very much a part of healing, a part of our lives, a part of everything that we do. Now, the soul is also the seat of your memory, your feelings, your imaginations, your convictions, your desires, and your affections. You have a mind, you have a will, and you have emotions. So I just want to ask you to ask yourself some of these questions, even as you practice preventive health on yourself. What is on your mind? What are the things that occupy your mind? What do you think about? How do you see life? Do you have the half full mentality or the half empty mentality? When we say the half full, the glass is half. But somebody will say, oh, this is half full. That is hopeful. That is optimistic. That is looking up. Or do you have the half empty? Oh, this is a half empty. In other words, pessimistic kind of. Positive thing. You know, when you go for psychology, when you have issues and you have a psychologist talk to you, these are the things they'll tell you. So why don't you start practicing it for yourself now? Think positive about yourself, about your spouse, about your children, about your family, about friends. What occupies your mind? What are your thought processes? We need to look at that because it's all part of preventive health that disturbs or worries us. You know, do you show love to others? Forgiveness. And this, I was talking to someone today and I heard for the first time, practice deliberate forgetfulness. Let it go. I refuse. Intentionally. Deliberate forgetfulness, bitterness. You have all those things, anger in you. These things are all acidic. They sort of make the whole system. And you know, you'll be amazed that these things affect your health. Last week again, I was in the clinic, and I don't know, anytime I'm asked to come and give a talk, I have a lot of people passing through the clinic and the issues that come up just there. And a young man who came in and we've done all the tests, he has something like what he describes as a panic attack. He says suddenly it can come anytime, difficulty in breathing, and then it's as if something, you know. So I was just looking at him. Every test he brought was normal. I was asking myself, hey, sometimes we think that we're going to sit in front of the doctor and it's like Mrs. or Madam Know-all or Mr. Know-all. Hey, Lord, so what next? So I asked him, is there anything worrying you? Then he started. Wife left him some 2 years, and the mood in which he was left brought the drink to where he worked, gave it to him. I mean, the whole series, not to talk too much deeply, but he wept. He wept. And I could tell that alone was like, he probably hasn't done that even since the thing happened. I could tell he was thanking, he was just thanking me. I just gave him some tissue and just talked. But he was so grateful. He said, thank you so much for your care. Thank you for your care. Thank you for, no, this person didn't come with a physical, no. It's an emotional. So why don't we ourselves try and prevent some of these things by practicing these things? Why won't you let that person go? Why won't you forgive that person? What is it? Why won't you let it go? That bitterness, and learn to laugh. Humor. Remember that I was telling you, we are on a journey to our mountaintop. There are valleys, there are low times, a loss here, something there. There are low times, but you have to get up, dust yourself, and continue the climb to that mountaintop that the Lord has for us. Learn to laugh. I was trying to Google the muscles that we laugh with, and I found in 2 areas that some books say 11 muscles for smiling, and then 43 for frowning, and then 11 and 12, whichever one, the frowning muscles are more than the smiling ones. So let's smile, let's be happy, and let's be humorous and let things go in our lives. So in summary, before you ask questions, the human being is a body, soul, and spirit. Remember, preventive health must be practiced in these 3 dimensions with diligence and consistency, consistently watching what your thought processes are, diligently checking your health, diligently doing this. Lifestyle modification and regular checks are the way to go. Know your values. If you haven't done them this year, please make time to do them. Remembering that your very existence is about fulfilling purpose and a calling as an individual, as a spouse, as a parent, and as a professional. I just put this picture here. I don't know what you are planning to eat tonight, but this shouldn't discourage you, don't worry. This is an example of a good plate. Fruits and vegetables occupying half of it, carbohydrates and proteins over here. Another example of a good plate. So I found this and I also put it there. Thank you is not just a phrase, but a way to a healthy lifestyle. Thank you very much for your attention.
Thank you so much, Ayungo, Dr. Anand. That was amazing. That was wonderful. We are always learning every day. So it's time for questions. I asked you to put your questions there. Somebody wanted clarification or the difference between 1 and 2. I'm not sure which slide that was. I think when you ask them to choose one and two, which one they want to.
I'm sure that may have been it. Yes. So somebody chose
Yes.
two.
Yes, somebody chose both of them, one and two. Somebody chose two. And somebody is
So what?
asking, what's the difference between the one and the two?
Okay, so what I just wanted to say is that don't wait to go and check yourself first for the condition. Practice your lifestyle change first and then be doing your regular checks.
Okay.
That's just what I wanted to take home.
Okay, okay. Great presentation. I just said great presentation. They've been, I mean, I can attest to that. We've really enjoyed this presentation. My take home was the lifestyle modification, 0 smoking, 5 minutes of 5 helpings of vegetables daily, 10 minutes of relaxation daily. Your BMI shouldn't be more than 30, and then 150 minutes of moderate exercise every week. That is my take home for today. Please, I've allowed you to unmute your mics. If you were not able to put it in the chat box and you want to speak, you can unmute yourself, raise your hands, and we'll let you speak. So I have super work and efforts have been invested. Many thanks, Doctor. We need to free ourselves for our own good. Amen. We need to free ourselves. Prof. Roderick says, outstanding presentation, Ayongo. Thank you. I like the 0 to 150. Must remember them. Indeed. Patrick. Patrick sends me a message. I don't understand. Okay. What else? So if you have any if you have any questions, please unmute your mic so that you can ask the question. Okay, so I had a question. I'm asking for others. The cervical cancer vaccination for children, boys included?
Yes, you can also vaccinate your boys, especially with the Gardasil, the quadrivalent. Yes, boys
you can.
included.
So the boys are included. Excellent.
Yes.
Okay. Yeah. Somebody says ASPA is not only concerned about our wards, but the health of which we. Okay. Okay. All right. I think. Who's ASPA? Okay, let me go on. Can the 5 helpings be different fruits, or can it be the same fruit?
Actually, it can be different. You see, that's why we say it's fruits and vegetables. So if you look at it, you see the vegetables, we are thinking about the foods you are eating within the day too. So your soups, your stews are all within the vegetables.
Okay.
So you would have taken lunch, maybe some soup, dinner, maybe stew. So they are all classified as vegetables. Then you can add an apple here, an orange there. So they are all classified as helpings.
Okay.
So you should have at least 5 of those. Yes.
Okay. Okay. Does the 150 minutes a week also refer to children?
I'm sure they are doing more than that per week. If
exactly.
We give them a chance.
Exactly. We advocate for at least 1 hour of moderate exercise for the children. And most of them, I mean, if you allow them to play, most of them will be doing much more than that. But when it comes to the adolescents, sometimes you have to insist because they can just be behind the screen or in their rooms and they won't do any exercises. So at least for them, at least 30 minutes a day, I think will be fine. Okay. Okay, now more questions are coming. Hello, can breastfeeding mother be infected with breast cancer?
Yes, she can.
So it's possible.
So it's possible.
Yeah. Okay. When your BMI before pregnancy is normal, but during pregnancy or after pregnancy, it becomes obese, what do you do?
So after the pregnancy, you have to begin to put measures in place. And then, sometimes after pregnancy, they give you the idea that you should eat a lot because you are breastfeeding.
Yeah.
But we know that, I mean, you need to be moderate and you start your exercises too.
Okay.
Yeah.
Okay. So if you get pregnancy weight and you become obese during or after, you have to do the same things that you've advised for weight loss, I guess.
Yes.
Okay. And may I add to it that actually the breast milk, if you are having, so far as you are not starving and you are having just the right amount, you don't need to overeat for breast milk to flow. You do need to drink more water. So for breast milk, no matter what you take as the mother, the energy will be taken before the left is the rest is left for you. Yes,
Yeah.
the rest is left for you. But the most important is the hydration. The more water you drink, and if you are relaxed, if you are stressed, your breast milk won't come. So relaxation, stress-free, and drink lots of water and eat your normal calories. Don't take more. Okay. Is daily house chores also a form of exercise? Daily house chores. Can we say that is moderate exercise?
No, it's not moderate, but it's
Okay.
a form of activity. I mean, you are being active, but you should include something else to it.
More than that.
More
Okay.
than just the daily chores. Yes.
Okay. Okay. Excellent. I have a lot of great work, nice presentation, etc., etc., etc. Thank you very much. I think I've read all the questions here. If anybody has any more and they want to lift up their hands, you can do so. There was a question about if you get the presentation. And go, will you give us the presentation?
Yes, I will.
Okay, so once I get it, we shall let you have it. Actually, this was also recorded on Facebook Live.
Okay.
So you can go to our Facebook page and you'll see the slides and the presentation and the recording. So you can watch it again. All right. So when is the next session? Somebody's asking when is the next session? So thank you for your question. We're going to have, as usual, parents roundtable discussions happen every month. This year, we are doing it every third Saturday of the month. We have a parents roundtable WhatsApp group that we can that you can join, so that we put the announcements and things there so that you have an idea what is coming up next. If there are any changes, we'll let you know. But in February, we'll be talking about sleep. We'll be talking about the importance of sleep in our children and some of the challenges that we have during about sleep. So make a date with us next month, February 3rd, Saturday on Zoom, 5 p.m. to 6:30 p.m. We'll send out the flyers next month. Okay, there are more questions coming. Ayungo, I hope you are not gone. Says my wife has had 3 C-sections. What type of exercises can she undertake to help keep her in shape and fit?
Oh, 3, like, not how long ago? I mean, once the C-section
It's over.
is over and you have been cleared and she's fine, she can start her exercises.
Yeah.
And then also remember that diet too plays a role, so all those can be done.
Okay. Somebody said they've been out on the lawn pulling out weeds. So that should count as moderate exercise. But pulling out weeds is, I think that one is moderate exercise. It's a lot of work. Oh.
But he doesn't pull it out every day or 5 days a week. For that one day alone, he has to top up.
So Bobby, you have to top up from the weeding and do some walking. Okay. All right. Okay, if we don't have any more questions, thank you so much, guys, for joining us today. We had a full house. We were 100 These days we can take only 100. So the rest of us joined on Facebook. Yes, so we had a well man and well woman clinic. We didn't get a lot of parents patronizing, but since we've had this talk, I think we can bring it back. A well man and well woman clinic. Now that you've heard Dr. Ayungo Annan, we can have this available for you at Mission Clinic. So please give us a call if you need to be seen by a family physician or a physician specialist and you want to do your routine labs, your medical checkup. If you need a breast examination, you can still call us on the numbers there and we can sort you out. Thank you so much. Thank you, Dr. Annan, for this evening. It's been an excellent presentation. I hope you will join us for the other ones too and listen to it. Okay.
Okay, I will.
All
sure.
right.
Thank
Okay.
you very much.
Okay. Thank you. Thank you so much. Thank you, guys. See you next month, third Saturday. Bye.
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 Bye. God bless you.
Bye.
God bless you too. Bye. Hey, who's that?
Thank you.
It's registering his voice. Why?
Hi. He was also listening.